So welcome to the fifth presentation on Krok 1 2016 booklet. Krok 1 2016 booklet. All right. So a patient had a trauma that caused dysfunction of the motor centers. Guys, who can remember where the motor centers are? Motor centers in the brain. Where is it? We talked about it the last time. The what? Good. The pre-central gyrus. Exactly. You guys talk about it. We talked about it. We talked about the Brodmann's areas. We talked about them the last presentation. So please, this shouldn't be new. If you missed it, please do well to revisit that presentation. All right. So a patient had a trauma that caused dysfunction of this motor center regulating activity of the head muscles. In what part of the cerebral cortex can these centers normally be located? So the motor centers, where are they located exactly? So like you rightly said, we are talking about what? The pre-central gyrus. Why? Because that is the site for primary motor cortex. To be specific, the Brodmann area number 4. Brodmann area number 4. And I think we discussed this extensively, and we said over here we are dealing with what? The inferior pre-central gyrus. The inferior pre-central gyrus. So over here you are, or we will be talking about what? About C. And I gave you guys an assignment to look for what? The supramarginal and then and the angular and all of those things. I gave you guys an assignment to look out for them, what they do. All right. So over here, your answer is what? The inferior part of the pre-central gyrus. The inferior part of the pre-central gyrus. All right. And again, I was explaining that the upper or the superior part, deals with what? They deal with the head muscles. So the inferior part deals with the head muscles. They deal with the head muscles, whilst the other part deals with the lower extremities or the lower what? Limbs, basically. These are what we're talking about. But over here, we are dealing with what? The head part or the upper part of the body, the upper part of the body. And that's over here, we are going in with the inferior part. So here, your answer is C. Your answer is C. At the post-mortem examination, the stomach of a patient with a renal failure was found to have a yellow-brown coating on the thickened mucosa. The coating was firmly adhering to its surface. Firmly adhering to its surface. Even before you continue, what kind of inflammation will you be looking at for? Something that is firmly adhering. What comes to mind? In the way that when you begin to remove it, it causes bleeding.
Diphtheric, fibrinous.
Diphtheric, exactly. Diphtheric. And diphtheric is a type of what? Fibrinous. Exactly. So now let's continue. This person had a significant thickness. Microscopy revealed a congestion and a necrosis of mucosa and submucosal what? Layers, fibrin present. Again, it is telling us that we have what? A fibrinous type of what? Inflammation. So what is the most likely diagnosis? Actually, if you want the most likely diagnosis, is what? A diphtheric type. Diphtheric type. Because under fibrinous, we have what? The diphtheric and we have the crupus. Crupus are easily removable, or they are not firmly adhering to the surface of the mucosa, whilst diphtheric are firmly adhering to the surface of the mucosa. And so therefore, when you try to scrape it or when you try to remove it, it causes what? Bleeding, or it causes hemorrhage. Of course, in the absence of diphtheric, of course, our best bet will be what? Will be what? A fibrinous type of what? Gastritis. A fibrinous type of gastritis. A 60-year-old man suffering from chronic hepatitis. Chronic hepatitis. Again, what are the markers for chronic or for hepatitis or for infection of the liver? Who can tell me? What are the biomarkers? What do you look at for? What enzymes?
AST, ALT.
Very good. Don't forget, the same AST and ALT can also be found in the lungs. Is it? No, the heart, sorry. Can be found in the heart. But then again, I told you guys where to be more and where side to be more. I'm going to mention it here because I've said it again. I've said it before. So please, if you really want to remember it, go back and listen to that presentation. Go back and listen to that presentation. All right. So over here, we're having a problem with what? With the liver, a chronic hepatitis. And the person is having what? Nasal and gingival what? Hemorrhages. Spontaneous hemorrhagic rashes on the skin and the mucosa. Such presentation result from what? Such presentation result from what? Now over here, they are not actually telling us or asking us to find out what is the biomarker, isn't it? That is not the case. The question here is that what is causing the hemorrhage? What is causing the hemorrhage, the spontaneous hemorrhages? And of course, you know when it comes to hemorrhages, what comes to mind is our what? Our coagulation factors. What comes to your mind is the coagulating what? Factors. Coagulating factors. And these factors are produced or they are synthesized and released from the liver. So if we are having a chronic problem in the liver, what it means is that these substances cannot be produced or their production will be hindered. And of course, if you look at our option here, what will be your best bet? Of course, we are talking about what? The prothrombin and the fibrinogen, because these are involved in coagulation of blood. Coagulation of blood. And when blood are not coagulated, what it means is that you can easily bleed. As simple as that. Now again, this is not talking about edema formation. In edema, you know what to talk about. Belly albumins. And again, we are not talking about what? The biomarkers for the liver to know whether there's an infection or not. If it is so, then aminotransferases comes to your mind. But this is talking about what? Hemorrhage. So coagulating deficiency or coagulating factors deficiency. And hence, your answer is decreased synthesis of prothrombin and fibrinogen. All right. Now, leading symptoms of primary hyperparathyroidism, are osteoporosis and renal damage. Now, before I continue, what is the main function of the parathyroid hormone? Who can tell me?
It aids in the reabsorption of calcium ions in the blood.
So calcium, long and short, calcium, they deal with what? Calcium. So this should be at the back of your mind. If you understand things like this, you won't suffer with your answers. Now look at it. There's what? Hyperparathyroidism. And so led to what? Osteoporosis and renal damage, resulting in urolithiasis development. What it means is that kidney stones, and some of the stones can be as a result of concrement of calcium deposit. Calcium deposit. The question now is, what substances are the basis of urethritis in such cases, or the stones? And of course, you are dealing with what? Calcium phosphate. Calcium phosphate. Of course, uric acid can also cause what? Urolithiasis. But it has got nothing to do with what? The parathyroid hormone. So please don't confuse yourself at all. So here you are dealing with what? Calcium phosphatase. Sorry, phosphate. Why? Thyroidism. Thank you. An oncology department has admitted a patient with a suspected tumor in the lungs. On examination, a pathology localized within the lower lobe of the right lung was detected. Guys, look very well. The lower lobe of the right lung was detected. How many bronchopulmonary segments are there in this lobe? First of all, how many segments are there in the right lobe and in the left lobe? Who can tell me? Sorry, the right lung and the left. Come again?
In the right lung, we have 2 segments.
5.
And in the...
You guys shouldn't get me the question wrong. I'm saying, now I'm not talking about lower lobe. I'm referring to the entire lungs. How many segments do we have? We mentioned the last time.
I think they are 10.
10.
10. Exactly. 10. We talked about them. 10 anatomy. We talked about them. So don't get confused. Don't get confused. So we have what? 10 in each lungs. Then from there, we not have what the lobes. And I remember I started talking to you guys about the apical, the anterior, the posterior segment, the lingua, and all those areas. We talked about them. So guys, don't get confused. If you missed it, please again, visit the videos. Just visit those videos. All right. But over here, inferior lobe of the left. Inferior lobe. What is the question again? The question is that on examination, pathology localized within the lower lobe of the right lung was detected. How many broncho segments can be found? And over here, we will be dealing with what? How many lobes? Sorry, how many segments? 5.
Yeah.
5. We talked about them. 5, guys. 5. And these include the superior, the medial, the anterior basal, the lateral, and then the posterior segment. I repeat, the segments include the superior segment, the medial base, the anterior base, the lateral. Now, base means basal, so don't get it twisted. So the lateral basal and then the posterior basal segment. So these are the 5 segments. These are the 5 segments. So don't just mention it, know it or know them. All right. So here, your answer is E. Your answer is E. All right. And of course, the middle lobe has how many? 2, isn't it? The upper one will have what? 3, technically. All right. A 45-year-old woman suffers from arterial hypertension with high blood concentration of angiotensin 2. Before I continue, what is the function of angiotensin 2? We discussed it the last time.
Aldosterone secretion.
Yes, one of them. And on the vessels, what do they do? On the vessels, what
Vasoconstriction.
Vasoconstriction. Very good. Very good. Awesome. Now the question is, we are having what? A 45-year-old woman who's suffering from arterial hypertension with high blood concentration of angiotensin 2. What antihypertensive drug is the most recommended in the given case? Is Benjamin here? Benjamin, the guy is sleeping. Okay, he didn't come. So that means he's sleeping. All right. Now, you remember that. Okay, before I continue, what converts or what is involved in getting angiotensin 2? Who can tell me? We talked about them. Now, every question I ask here is because we have done them before. So, guys, if you are new and you are lost, please bear with us because we have just done them and we are just revising. Yes. Go on.
Maybe angiotensin converting enzyme.
Are you saying maybe or it is?
It is ACE.
Good. Don't let me punish you for nothing. So we are talking about
Dr. Ba, what was your question?
My question is, what is involved in activating this angiotensin 2, or what activates angiotensin 2, or what leads to angiotensin 2 activation? Of course, don't go and tell me about the renin, about the whole RAS system. Okay, I'm just referring to just that part that is involved in its activation. Okay. Because I know you have a whole lot of information about the RAS system. This is in the RAS system. Many of you know a lot. And I'm actually happy that you guys know it. But basically, what converts angiotensin 1 to angiotensin 2 is the angiotensin converting enzyme. And this is in the lungs. So if you want to prevent angiotensin 2 from happening, what will you do? You have to inhibit this enzyme. And so therefore we call it what? Angiotensin converting enzyme inhibitor. So if you look at the options over here, what is your angiotensin converting enzyme inhibitor? Who can tell me? They always end in what? In prayer.
Lisinopril.
Lisinopril. So your answer here is what? Is A. Sometimes they'll say captopril. Captopril. They are all in the same group. Lisinopril. So your answer is A. ACE inhibitor. Some of you have heard it before. An alcoholic suffers from alcoholic psychosis with evidence of psychomotor agitation. What neuroleptic can you give? What antipsychotic drug can you give? Neuroleptic. These are neuroleptic drugs, antipsychotic. And of course, you are dealing with what? Aminazine. Aminazine. So your answer here is A. Aminazine. Aminazine. All right. In one of the Polisia regions, there was an outbreak of Helminthiasis manifested by cramps and facial edemas. They developed preventive measures in particular included banned for eating infested pork even after heat processing. What Helminthiasis was the case? What Helminthiasis was the case? Guys, over here, we're not talking about the Saginata. Those ones, if you are Saginata and those things, you know them. We talk about them, their bellies, their uterines. We talk about them. One is less than 12. Other ones is more than what? 18 or more than 12. You know them, how to differentiate between the types of tapeworms. But over here, they are talking about what? Trichinosis. And again, we have done these things on our, if I'm correct, microbiology. Yes. Microbiology base. We've talked about them. We've talked about echinococcus and all of those things. We've talked about them. So please do yourself the favor and get those videos as well. So here is trichinosis. So the answer is A. A patient demonstrates a functional loss of nasal half of the retinas. What area of the visual pathway is affected? The visual pathway is, what visual pathway is affected? So here, we're talking about what? Loss of nasal half. The nasal half. Meaning that inside the nose, what can you find, or which part of the visual pathway can you see or can be found or can be impaired? That's the question. That is the question. And over here, we are looking at what? The optic chiasm. The optic chiasm. The optic chiasm. This is an X-shaped structure. X. It's like an X-shaped structure. X-shaped structure. And of course, you can find them in these what? Areas. In these what? Areas. In these what? Areas. So when it passes, sorry, not your nose. The question now actually referring to your nose. But the nasal, the part of the retina that can be found around the nasal area. So please don't say that I'm saying that the retina is inside the nose. No, it's not inside the nose. But of course, it's a tract. It's a tract. So the part that can be found around that area is the optic chiasm. The optic chiasm. So your answer is what? Is D, the optic chiasm. And some of these things is better with a diagram, but unfortunately, We don't have it here. All right. So the answer is D, optic chiasm. A 26-year-old woman with bronchitis has been administered a broad-spectrum antibiotic. Broad-spectrum antibiotic as a casual treatment drug. Specify this drug. Specify this drug. So we are talking about what? Antibiotic. Antibiotic. Now, even if you look at the options you are having over here, apart from one, the rest are not antibiotics. And that will be what? Doxycycline. 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 This is the only antibiotic present. Of course, this is a vaccine. This is a interferon is antiviral and all those things. So please take note of that. So over here, we are talking about doxycycline. Doxycycline. And so therefore, your answer is C. Doxycycline. It's a broad spectrum antibiotic. A 16-year-old man suffering from seasonal allergic rhinitis has been prescribed a highly active second-generation H1, that histamine 1 blocker, which can be characterized by the absence of marked sedative action. Name this drug. What it means is that we are having what? Allergic reaction. We are giving a drug that can block. Of course, we know it is histamine activation that leads to the reactions, isn't it? So now we want to prevent this thing from happening. And of course, what are you going to do? You are going to use what? Loratadine. Loratadine. This one, we discussed them extensively on the pharmacology presentation. So please, let's watch them. Let's watch them. Even if you have watched them, go and revise them. So your answer is what? Is D. Your answer is D. Examination of a 56-year-old woman with a history of type 1 diabetes mellitus revealed a disorder of protein metabolism that is manifested by aminoacidemia. Aminoacidemia in the laboratory blood test values. And clinically, by the delayed wound healing. There is wound healing. And one thing you must know that protein helps in wound healing, isn't it? Proteins, they help in wound healing. That's the only time we're asking to eat. Eat a lot of what? Protein. Fish. For me, my favorite protein is fish. And there's decreased synthesis of antibodies. Again, you know that proteins are involved in some of these things. Which of the following mechanism causes the development of aminoacidemia? Now, the word aminoacidemia is simply a condition in which the concentration of amino acids in the blood is abnormally increased. Abnormally increased. That is what? Aminoacidemia. So the question now is, what could be the mechanism of action? And don't forget, amino acids are the building blocks, or they are the smallest unit of what? Of proteins. So who can tell me what we are looking for? What process can possibly lead to the breakdown or the release of too much amino acid in the blood? Who can tell me?
Increase
protein.
Thank you. That means proteins are being broken down. Guys, you guys are too much. You guys are just too much. So that's what? Increased proteolysis. Don't go and say decreased concentration because you have seen amino acids. Oh, no. Understand the concept and answer the question. A patient with injury sustained to a part of the central nervous system demonstrate disrupted coordination and movement amplitude. Muscle tremor during volitional movement. Poor muscle tone. What part of the central nervous system was injured? Guys, coordination, we talked about it the last time. Coordination, posture and coordination is controlled by what part of the brain?
Medulla, cerebrum.
Cerebellum. We talked about them. Cerebellum. Posture, coordinations, movement, muscle tone. If you guys can remember, muscle tone, all of them are controlled by the cerebellum. Cerebellum. So when there's a problem in the cerebellum, a lot of things can happen. A lot of things can happen. So over here, definitely your answer is what? Is cerebellum. Cerebellum. All right. Understand medicine is so good when you're solving. Good. A 36-year-old patient has been administered a depolarizing muscle relaxant during a surgery. Guys, we normally give these things. And sometimes when there's a deficiency of one particular enzyme, this relaxation could prolong. Who can tell me that enzyme? Who can tell me that enzyme? For a high five, who can tell me that enzyme?
Ditilinum.
Cholinesterase.
I'm not talking about the drug. I'm talking about the enzyme. Someone just said it. He said what?
Cholinesterase.
Oh boy. Hey. See, chop kisses, guys. Chop kisses. If you're a guy, don't chop. If you're a lady, chop the kisses. So you, the guy that you don't smile, please. Don't chop my kiss. It's for the girl. Thank you. So name this drug. Of course, if you can know the enzyme, the drug is not easy now. The answer is what? Ditilinum. So when there's a deficiency of pseudocholinesterase or butyrylcholinesterase, they can have a prolonged relaxation and a decreased breathing. That is not part of the question, but it's good for your revision. So over here, your answer is what? It's ditilinum. The person who said it, thank you. So that's ditilinum. All right. I think one of these, I just allow you guys to answer all the questions. Guys, who can tell me the differences between air embolism, fat embolism, and thromboembolism? Just before we go into the question, who can tell me the difference between them? Who? Anyone? Or one can pick one.
I think I know that for fat embolism,
Good.
it's normally because of fractures in
Very
the
good.
lower extremities.
Wonderful. Another person, answer for thromboembolism. Another person. Another person, thromboembolism. What does it mean, thromboembolism? Oh, nobody? We've done these things, guys.
I think for thromboembolism is normally like when it travels from the leg, the lower extremities of the leg, all the way and clogs.
What travels?
Clots. Thrombus.
Good.
Thrombus.
It's clot, but inside blood, we don't call it clot. We call it what? Thrombus. Very good.
Yeah.
Thank you. But of course, air is air, isn't it? Gas na gas. Air is air. Gas na gas. So see, if you have this thing at the back of your mind, trust me, the question is bonus. And please, don't be using I think, maybe. No. You should know. That's my class for you. Know it. Don't be thinking too much. That means that if you are thinking, it means that when they wake you up from your sleep, you have to be thinking. But you shouldn't be thinking. Even when you are dead, they wake you up. Just answer. Very good. Now, look at the question. A man has suffered from multiple bone fractures. Even before you continue, you know your answer. True or false? You know. Because you know the mechanism. You know the mechanism of each and every single one of them. But for the sake of revision, let's continue the question. Person is suffering from what? Multiple bone fractures of his lower extremities during traffic accident. During the transportation to a hospital, his condition was further aggravated. Blood pressure decreased. Signs of embolism is there. Pulmonary artery embolism. What kind of embolism? Of course, your answer is what? Fat embolism. So your answer is what? Is C. Fat embolism. UN volunteers have arrived in Nigeria to assist the locals in aftermath of earthquakes. What drugs should be prescribed for individual prophylaxis of malaria? What means they must know what we give for people to prevent malaria. Don't forget, they are UN people. They are not in Africa. They are not from Africa. So if they get malaria now, Charlie, it will be serious. Or if they come and the mosquito bites them, they get into their country, they don't have the malaria therapies that we are having. I mean, the anti-malaria therapies that we are having in Africa. They don't have it over there. So malaria in Europe is a very serious problem. They can die. So they must be given what? Prophylaxis. And of course, what do we use to give prophylaxis? And your answer is what? Gincamicin. Sorry. Gincamine. And how you need to pronounce it. But again, what type of plasmodium? Don't go and say female anopheles mosquito. I know. What type of plasmodium is very, very, very troublesome? I mean, for cause malaria. Troublesome malaria causative agent. The plasmodium. It's a revision. Who can tell me?
Falciparum.
Oh, Lord. Guys, are you guys sure you people are doing Krok 1? The way you people, your knowledge is too much. After an extended treatment with sulfonamines, a patient has developed macrocytic anemia. First of all, what are the two causative agents for macrocytic anemia? Macro. We've discussed it a lot of times. Macro. So who can tell me? Two things. What comes to your mind? What and what?
B12 and folic acid.
B12 folic acid.
Thank you. Pernicious anemia, basically. So the question is that production of active forms of the following vitamin is disrupted in such a condition. So over here, you are looking at the problem with either what? Folic acid or vitamin B12. But of course, another name for vitamin B12 also could be what? The cyanocobalamine, basically. But over here, these sulfonamides, they rather prevent the absorption of folic acid, not the other one, not vitamin B12. So please take note of that. Yes, both can cause what? Macrocytic anemia. But with the treatment of the drug given, you're dealing with what? Folic acid, guys. Folic acid. So your answer is what? Is A. And again, what factor helps in the absorption of vitamin B12? What factor?
Increasing factor.
Charlie, you are asking me a question. If you ask me a question, you take a fine. Increasing factor? That's the question. So just say, see, you have to be sure. You see, when patients come to our places and we are talking to them, they must have that kind of trust in us that yes, we know what we are talking about. Even if you don't know, just go it. Just say it. Don't ask them or don't say, I think. No, if you say I think, they begin to lower your competency. You understand? That is just by the way. But of course, you are still in the third year. But again, your knowledge is, Charlie, recommendable. But I want to start building you guys up for the world. All right? So forgive me when I say that. But then I'll still punish you for asking me questions. A woman resting in the countryside. Countryside, that's like maybe village, isn't it? They say it's village. Me, I don't know. A woman resting in the countryside has been stung by a bee. Again, we have talked about what? Hypersensitivity reaction, like previously. So in hypersensitivity reaction, what enzyme or what hormone is involved? Who can tell me? Oh. What hormone?
Histamine?
Yes.
Or mast cell?
Histamine.
Histamines are the guys that are involved. That's why we have to give an histamine inhibitor like the loratadine. Guys, loratadine. Okay, but let's continue. Stung by a bee. Immediately after, she developed pain in the stung area. In a few minutes, she developed a vesicle erythema, intense itching, is it lateral urticaria, expiratory dyspnea? Guys, all the journalists asked is that what factors resulted in the patient developing this dyspnea? And your answer is what? It's histamine activation. Histamine activation. Histamine activation. So the answer is what? Is C. Histamine. And again, what is the drug of choice? Loratadine. All right. Over here, we use ricin or cetirizine. I like prescribing it a lot. Autopsy of a 28-year-old patient who had been suffering from rheumatism and died of heart failure revealed pancreatitis. Guys, before I continue, who can tell me some of the complications of rheumatism? I mean, first of all, what can lead to rheumatic heart fever? What kind of infection can lead to rheumatic heart fever? What kind of infection? Who can tell me? Anyone? I think the Krok too, they know it very well because I taught them it like dozen times, so they know it very well. But basically, if you have infection for, how do you call it? Tonsillitis. Can you remember?
Streptococcus.
Thank you. You see, you can remember. So these things, and one of the complications that they can cause is to cause mitral stenosis or, how do you call it? Infective pericarditis. These things, they can cause them. But the question is not about these things. Now let's look at the question. The question is that there's what pancreatitis. I mean, the whole heart is infected. Pancreatitis. So histological investigation of the myocardium of the left ventricle posterior wall and the interventricular septum detected a perivascular cellular focal infiltrate. Guys, infiltrate, composed of macrophages and creating a palisade structure surrounding areas of fibrinoid necrosis. Determine the type of myocarditis. Ladies and gentlemen, yes, you might be confused with the fact that there's a focal infiltration, and so don't go and say this one you are dealing with interstitial exudate, blah blah blah. Yes, any sort of fluid accumulation is called what? An exudate. No doubt about that. But the whole process leading to the formation of necrosis, these are all what? An inflammatory process. And that phenomenon whereby we are having all of these how do I call it? Inflammatory cells occurring at that place, the term is called what? Granuloma. Granuloma. So this is a granulomatous condition. This is a granulomatous condition because the infiltrate composes of what? Macrophages and creating a palisade structures surrounding areas of what? Of a fibrinoid necrosis. So this one, it will not be right for us to say this we are having what? And though it is focal because it is focal, okay? We can't say we're having what? A focal interstitial exudate because this will be more of a fluid accumulation, like in the case of abscess formation. That we could have gone for that. But this is taken as the type of myocarditis. We are talking about inflammatory type of what? Myocarditis. So over here, your answer will be what? A instead of what? Focal interstitial exudate. All right. When ascending to the top of Elbrus, a mountain climber experiences oxygen starvation. Guys, do you remember when I said when you are the higher you go, if you are trying to reach heaven, God will make sure that you will not have enough oxygen to reach him. This is the condition. So the higher you climb on mountains, the lower what? The oxygen saturation or the atmospheric oxygen will be what? Will be low. Atmospheric oxygen will be what? Will be low. And when atmospheric oxygen is low, what develops? Of course, low oxygen. Low oxygen will be developing. All right. So now, let me see if you guys can remember this now we discussed. When there is oxygen starvation, what do you think is going to happen to the red blood cells? Anybody? In terms of, would there be a decreased number of red blood cells, increased number of red blood cells, or there will be new generation of red blood cells? And so we're going to find, how do you call it? So we're going to find immature red blood cells, immature red blood cells in the blood smear. Who can tell me? Anybody? We've discussed it before. So I want to see how you understand it. Oh, nobody. We'll discuss it when we talk about trauma. When people are bleeding, what happens? Okay.
Decreased red blood cell.
Why would there be decreased red blood cells? Now you are in a mountainous area. Okay.
Breaking of reticulocytes.
Come
It's
again?
an increase.
Yes, red blood cells are going to increase. And why are they going to increase? They are going to increase as a way of compensation mechanism or compensatory mechanism. So the red blood cells will increase in your system so that there will be enough red blood cells to absorb even the little oxygen in the atmosphere. So it will increase the oxygen consumption. I don't know if you guys understand what I'm trying to say. So it will serve as what? A compensatory mechanism. That is why those who run, those from Kenya, they can run from 5,000 miles and they are still running. Because they are staying where they stay, they have a lot of what? RBCs. So there's a lot of RBCs to absorb more oxygen. So they can be running and still don't get tired. So never compare yourself to a Kenyan person in terms of running. Don't try. If you try, you could die and you will still be there, smiling at your face, smiling at you. Okay, that's just by the way. That's just for us to revise. Okay, that's just by the way. All right. Now, when this happened, it led to what? Dyspnea, palpitations, numbness, of course, because blood is not reaching the symmetries, or even blood is reaching the oxygen is low. The question now is, what kind of hypoxia? Now, hypoxia means low amount of what? Oxygen. That's what it means by hypoxia. What kind of hypoxia has developed in the mountain climber? All right. So over here, take a book and start writing something. Now, when we say hypoxia, or in this question, we'll be dealing with what we call the hypoxic type of hypoxia. Hypoxic type of hypoxia. And hypoxic type of hypoxia develops when there is a decrease in the barometric pressure. In other words, when there's a decreased concentration of what? Oxygen in the atmosphere. As simple as that. Decrease what? Oxygen, or the partial pressure for what? Oxygen is decreased. That is when we have what we call what? The hypoxic hypoxia. So over here, like I said, when you are going up, there will be decreased what? Partial pressure for what? For oxygen. And that's over here. I said the answer is what? Hypoxic hypoxia. As simple as that. Now, we also have what we call a respiratory hypoxia. And this arises as a result of a respiratory insufficiency. Example could be when we are having hypoventilation. So in this question, it's not that the person cannot breathe. The person can take in air. Just that the oxygen in that air is small. So it's hypoxic. In respiratory, or of course, can also say circulatory, but in respiratory, it means that we're having a problem with respiration. So please again, take note of that. Problem with respiration, or problem with lungs and things like that. So all of them fall under what? Respiration. Then we have what we call a tissue or histotoxic hypoxia. Tissue or histotoxic hypoxia. And this is the type of hypoxia that is produced by the inability of the tissues to utilize oxygen. Inability of the tissues to utilize oxygen. And this can result from tissue poisoning. So when there's a tissue poisoning, it means that the tissue cannot utilize oxygen. That is called what? A tissue type of what? Hypoxia. A tissue type of hypoxia. So any harmful substances, please think about them. Now, in hemic, of course, the name hem should tell you that we are dealing with blood, isn't it? Or hemoglobin. Good. So in hemic type of hypoxia, it is connected with hemoglobin quantity. Hemoglobin quantity or inhibition of their functions. Either inhibitions of their functions or their quantity. So sometimes if there's a pollution with carbon monoxide, what happens is that the bad gases get attached to the hemoglobin. That means that the hemoglobin will no longer, or the hemoglobin will, oxygen will have a competitive person to be fighting with, isn't it? Which will be what? The carbon monoxide. So please take note. So that when that develops, we have what? The hemic. Then we'll talk about the cardiac or cardiovascular. The cardiac or cardiovascular type of what? Hypoxia. Definitely, this deals with a problem with blood circulation that is due to the heart or vessel pathology. Heart or vessel pathology. Please, this is a new thing. That's why I took my time to explain for you guys, because I don't remember we have discussed this in one of the bases. That's why I'm taking my time to break it down for you. So please, I hope you wrote something. So over here, we are dealing with what? Hypoxic. So please take note. When I move fast, the question means that we've done them. Okay. Now, a 2-year-old boy is diagnosed with Down syndrome. This one, I don't even worry myself. Your answer is what? Hey, let's go.
Trisomy 21.
Thank you. By now, you should know Edward, you should know Patau, you should know trisomy X, you should know them. Please, if you don't, do yourself the favor and get access to those videos. A 62-year-old patient has been hospitalized due to massive hemorrhage, massive cerebral hemorrhage. Blood pressure is even low. So shock is developing, isn't it? Heart rate is 120. Respiratory rate is 4. That is serious. 4. That, who can tell me the normal respiratory rate? What range? Oh, we've discussed it. Yes, 16 to 20. Thank
60.
you. Good. So it is not one value. It's 16 to 20. Because this one can never have a significant value. I mean, one single value. It is 16 to 20. So take note. So anything more than that, it means that the person is having what? A dyspnea or difficulty in breathing. If it's lower than that, the person is not even breathing. So you see, unconscious, no response. Such condition can be determined as what? Now, if you don't take care over here, you get confused. Oh, because there's low blood pressure. Many of you be thinking that this could be what? This could be shock, but please, this is not shock. This is coma. This is coma. There is what? Massive hemorrhage. Massive hemorrhage inside the brain. So when the brain vessels are being destroyed, guy, it's dangerous. Very dangerous. So this person, look, even though he's having shock, he cannot breathe. Or he's not even respiring. 12 is too low. Unconscious, no response to stimuli. So this is what? This is coma, not shock. This is coma, not shock. So please don't get it twisted. A 3-year-old girl with mental retardation has been diagnosed with Niemann-Pick disease. Niemann-Pick disease. That is what? Sphingomyelin lipidosis. In this condition, synthesis of the following substances is disrupted. Guys, this one, no need to go and call me to come and answer for you. Your answer is right in your question. So your answer is what? What condition is disrupted, or what synthesis has been disrupted? Of course, 8 enzyme is disrupted. 8 enzyme is disrupted. And that is what? Sphingomyelinase. Sphingomyelinase. So your answer is B. Sphingomyelinase. Yeah, B. All right. So this is what? A lysosomal abnormality, or a lysosomal disease. A lysosomal disease. Don't forget, we have glycogen storage disease. We also have what? Lysosomal disease. What condition may develop 15 to 30 minutes after re-administration of an antigen as a result of an increased level of antibodies, mainly IgE? Guys, that are absorbed on the surface of target cells, namely basophils or mast cell and blood basophils. Guys, first of all, what type of hypersensitivity is this?
Type 1.
Anaphylaxis. Guys, a minute. Give me 1 second. They've called me. I'm coming. There's a problem coming. So let me just pause. Good. So what are we looking out for? Like you already said, you are thinking of what? Anaphylaxis. That is what? Type 1 hypersensitivity. Type 1 hypersensitivity. Who can tell me another name for type 1 hypersensitivity? Another name?
Reaction.
Good. Another name? Again?
Atopy.
Good. Very good. So these are another names for it. So if they don't bring this in the right atopy, Regine, please don't say Dr. BAHA didn't tell me. No, I told you like a dozen times. Now, local anesthetics. That is these, lidocaine, blah, 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 decreases pain sensitivity of the tissues by blocking the sodium potassium ions from permeating the membranes of nerve fibers and findings. Such mechanism of drug action is called what? So where do we find these sodium chloride ions? Where do we find them? Who can tell me? Where do we find them? We find them on membranes. Don't forget membranes. Come on, guys. Membranes. You have what? The potassium chloride pump. The sodium potassium pump. They are all on the membrane. So over here, what's the mechanism of drug action? Yes, you are dealing with what? Membrane ions. So your answer here is what? Is C. Membrane ions. Why? Because these sodium potassium ions are found on membranes. All right. After a road traffic accident, a victim has tachycardia. Arterial blood pressure is 130/90. Tachypnea. The skin is pale and dry. Excitation of the central nervous system is excited. Guys, we talked about it. What shock stage is the patient most likely? And then we're talking about it, and I said that when Faustina touches me, oh man, what happens to me? Ooh, my brain starts getting what? Excitation. So what are you thinking about, guys? Who can tell me?
Erector.
Exactly. You can even ask Emmanuel. He can attest to it. Even Osbeth, can you attest to that or not? Of course, he can attest to it. Hey, you won't mind me, Osbeth?
Yeah.
Yeah. Thank you. So if you ever get this question wrong, anybody, I'll come to the exam room, slap you, and tell Krok that I said they should fail you. As simple as that. I'll come slap you, take you out of the exams, and tell people to fail you. So please never forget this. Why? Excitation when touched by a woman, when touched by Faustina. Oh my, oh my. Please, guys. A woman complained of a sharp pain in her lower abdomen has been delivered into an admission room. A woman. A gynecologist on examination makes a provisional diagnosis of extrauterine pregnancy. What's another name for extrauterine pregnancy? Who can tell me another name?
Ectopic.
Thank you. Ectopic. So what anatomical structure should be punctated, whatever, to confirm the diagnosis? Guys, we are talking about what? About a woman. So what, I don't want to say pouch, but what pouch are we looking at for in a woman? We've discussed this before. And over here, you are dealing with what? The pouch of Douglas. The pouch of Douglas. And that is called what? The rectouterine pouch. Rectouterine pouch. And this is an extension of the perineum between the posterior wall of the uterus and the rectum in females. Between the uterus and the rectum of the females. Now, this is the farthest point of the abdominopelvic cavity in women. Abdominopelvic cavity. Guys, look. Abdominopelvic cavity. Uterine pregnancy is around that area. Abdominopelvic cavity. So if you want to check for confirmation, you have to what? Check that area as well. And that can help you. And again, a lot of infections and fluid accumulate in this pouch in females, a lot of them. So sometimes when females come to us with a lot of cysts and a lot of fluid, so that you can locate them in this Douglas pouch or the pouch of Douglas. All right, so over here, you are dealing with what? With the pouch of Douglas or the rectouterine pouch. So your answer is B. Please, woman. A passenger of a fixed-run taxi has a sudden and unexpressed attack of tachycardia. Okay. A doctor traveling by the same taxi has managed to slow down his heart rate. Okay, by pressing upon the eyeballs, and that's causing the following reflex. So what reflex occurs by pressing the eyeball? What reflex occurs by pressing the eyeball? That is what it means, as simple as ABCD. And over here, Krok will try to confuse you, but the type of reflex is called oculocardiac reflex. I repeat, oculocardiac. Oculo means eye, isn't it? Cardiac means heart. Yeah, it's not in your head. Oh, it's easy. Exactly. But Krok will not tell you this is oculocardiac reflex. Another name for the oculocardiac reflex is what we call the Achner reflex. The Achner reflex or the Achner reflex. Achner or Achner reflex is the same thing. The Achner reflex. The Achner reflex. And this, so basically, deals with what? The extraocular muscles, and of course, deals with the heart as well. So these are the reflexes that happens when you press the eyeball. So over here, you are looking at what? At the Dagnini actiony reflex. Again, another name is called what? Oculocardiac reflex. Oculocardiac reflex. This is where a decrease in the pulse rate is associated with the traction that is applied to the extraocular muscles or the compression of the eyeball. So please take note. A 27-year-old man developed intestinal colic against the background of essential hypertension. Essential hypertension. That means pain in the intestine. Guys, if there's pain in the intestine and you want to stop it, what will you do? Who knows NOSPA?
NOSPA or
Good.
Dopatherine.
Thank you. So you're dealing with NOSPA. And NOSPA are simply anti-spasmodic. Anti-spasmodic means against spasm. Against spasm. It's when there's spasm, that's when there's pain. Against spasms. So anti-spasms will prevent what? The stomach pains. So in this situation, it will be most efficient to arrest the colic by administering, of course, you give what? The NOSPA or myotropic antispasmodic or muscle relaxant. These are also called muscle relaxant. Muscle relaxant. And this can help to manage both the intestinal pain and even hypertension. You know, when the muscles are relaxed, your pressure will somehow reduce, isn't it? That sometimes when people come with hypertension, we give them some drug that will relax them. Who can tell me some of those drugs that will relax them? Can you remember the thing that end with LOL? Propranolol. Can you remember them? This one will relax you. So that's the beta blockers, isn't it? All right, that's it by the way. So over here, the answer is what? It's D. Antispasmodics. All right. A therapeutics has an appointment with a 40-year-old patient complaining of recurrent pain attacks in the hallux joint and their swelling. First of all, who can tell me what disease we're even looking for in this place? Where your hallux? Do you know your hallux? Your hallux. Your what?
Big toe.
Good. So what kind of infection or what kind of, I won't say infection, but what kind of condition will lead to pain in that joint? Who can tell me?
Is it accumulation of uric acid?
Gout.
Exactly.
Gout.
So it's gout, accumulation of uric acid. Yes, gout. Now I'm asking this question because if you know the diagnosis, you will know your answer straightforward. In fact, you will not think twice. Recurrent pains in his hallux joint and their swelling. Urine analysis revealed marked acidity. Now they've even given more clue. Marked acidity. So too much acid, pink color. What substance? Guys, don't call your ancestors. Your answer is what? It's uric acid. And again, from what metabolism is uric acid coming from? What food metabolism? What kind of metabolism? I won't say food,
Protein.
Good, but what kind of is it the pyrimidines or the purines or what kind of?
Purines.
Guys, purines. I'm saying this because sometimes they will say there is a problem with purine metabolism. And again, gout will always sit in your head. Gout, uric acid. And again, what enzyme can you be thinking about in the final stages of uric acid metabolism? Who can tell me what kind of enzyme will you be looking at?
Is it ammonia or?
No.
Antioxidase.
Thank you. Xanthines. Guys.
I think yes, xanthines. Yes.
Guys, now you're saying yes. You can remember we said them. We talked about them, isn't it? You can remember. So please, this is how learning is. Learning is application. Always apply. And that's what Krok will do to us. Will try to confuse us, but it's the same question. Some of you go say, oh, there's a new question. It's not a new question. It's just formulated differently. But if you understand the concept, no cause for alarm. You are good to go. That's why I always take my time to do the best that I can to make sure you understand it. So that in real life, you can always apply. Not for exams, but apply in real life. So over here, your answer is what? Your answer is E.